Now for the latest on the race for a vaccine for the COVID-19 disease, I think we're going to call it. Dr. Kathleen Neuzil, director of the Center for Vaccine Development and Global Health at the University of Maryland's School of Medicine. Doctor, thank you for joining us this morning. We're all trying to figure out what the duration of this situation looks like from a health perspective and invariably from an economic one. How do you see it?
You know, we're reluctant to make any guesses at this point about how long the outbreak will last. I think you heard from Dr. Fauci and others that we're doing everything we can as aggressively as we can. We do think it's important, though, to have a medium-term and long-term vision, to be working in parallel on very specific treatments and vaccines that can help mitigate this in the months and perhaps years to come. You know, we don't know if we will be living with this virus, for example, on an annual basis the way we do with influenza.
Beyond remdesivir and the optimism around that, is there any other drug out there, other experimental things taking place that give you a sense of optimism right now?
Yeah, again, it's very early times, but what researchers are doing is very aggressively looking at drugs that are already approved for other indications, because those will be the drugs that we can use the fastest.
So
one is chloroquine chloroquine or hydroxychloroquine, which is something that's probably been given to billions of people over the course of time for malaria treatment. It's shown very good effect in the laboratory in animal models against this virus, and so studies are already starting looking at chloroquine both to try to treat people with COVID-19, but also to potentially be used as a prophylactic to keep people who are exposed from getting COVID-19.
Real quick, because I've been asking a lot about the drug that you just mentioned over the past week and a half, and we've asked Scott Gottlieb, who ran the FDA, about that. He's been less optimistic about that particular drug. Do you know why? We're going to talk to him a little bit later.
Yeah, I think it's better to get that straight from him. Again, it's a drug that's been used. It's a drug that's been well tolerated. It's a drug that we have now. We would like to do this as part of trials so that we can learn and it can be more informative to us going forward.
Hey, Doctor, nobody knows about the eventual progression of this. I mean, it is a plague. It's terrible worldwide. We don't know about reinfection. We don't know about seasonally whether it comes back every year. But we have 9,000 deaths globally right now, currently. And that includes China, South Korea, Iran, Italy, the United States. 9,000 deaths. Do you foresee millions of deaths in the United States before this is over?
Again, I'm reluctant to make predictions. I firmly believe that the very aggressive social distancing and other strategies that we are implementing now will reduce the deaths.
Right, but would that surprise you? Would you think it's responsible to say that in a crowded movie theater?
You know, it would not surprise me, and we need to prepare for the worst. One reason that we would like to flatten the curve, and you're hearing a lot about that, is because we do have excellent medical care in the United States. What we're worried about is overwhelming that system.
Right, but how do we get there? How do we get there from 9,000 when we're talking about China, where it started, and South Korea? And, I mean, it's terrible in Iran, it's terrible in Italy, and it may get bad here. But how do you get from 9,000, where some seem to be on the other side of this? Perhaps, as I said, maybe it comes back. But how do you get to millions? You don't think that, I mean, maybe we should be scaring people, I guess, so that they don't go to spring break. But you don't think that's maybe overstating it, millions of deaths in the United States?
I don't think it's overstating it. Again, I don't think we understand. But if you look at it from an attack rate perspective, and this virus is transmitted easily, we have 350 million people in the United States, and you do the math. If 70 million people are eventually infected with this virus, and again, if there are multiple waves of this virus, then you can do the math, and then you can get there.
Then you think we're not going to be able we're just unable to do what China did then, just socially, and that's certainly possible because they were able to lock down. But, you know, we have 300 million, as you said, they had 1.4 trillion. So, but they obviously, it's a different situation. I'm not saying that they can, that would be a real tragedy, although when you do the math like that, and obviously the flu, the influenza in a bad year can kill a lot of people as well, a number that many of us didn't realize beforehand. But, okay.